way in the system.
Recognizing a member for Caribou North.
Thank you very much, Mr. Chair. Our success in all of this depends on our students and the confidence that our students have in the systems that we have in place. I do want to enter, I said I would raise it. We met with the UBC Political Advocacy Committee. I know that you were in estimates, so I committed to raise it here and table it. And it's 86,000 and counting, calling on the province of British Columbia to address elective surgical wait times in BC. They spent 7 months working on this very important report with lots of recommendations, so I just wanted to draw the minister's attention. To follow up on my colleagues' questions around the human resource strategy and how we are measuring outcomes and looking at net new healthcare workers, training is going to be a considerable part of that. And I have been working across the province and listening to a lot of students and to identify, it's wonderful that we're announcing all of these training seats, critically important to this strategy. But the piece that I think when we're looking at indicators is the enrollment numbers. And I think I'm glad that the Minister of Post-Secondary Education is in the room, because I want to ensure that there isn't a disconnect, that there is a significant amount of work being done on making sure seats exist, but making sure that the Minister of Post-Secondary Education is looking at enrollment numbers and making sure that there is that alignment. And if there are issues, for example, in Northern Health, in the training seats, we know that enrollment numbers are down. And that is a critical issue for the success of this strategy. What we've heard from specifically the nursing on the training side is we want a consistent provincial curriculum. There needs to be better transitioning from bridging from LPN to RN, that the LPN Access Program in British Columbia provides no credit for work experience, whereas Athabasca does. And so we are losing a lot of our students to go to Alberta because there is some of those training credits provided for work experience. I think that's critically important. We understand that. Loan forgiveness, that there is a lot of competition across the country from a training perspective. And I would say that a lot of the students are deciding not to stay in BC because they can access programs elsewhere. And it may be a factor in why our enrollment numbers are down. And so through you, Mr. Chair, to the Minister, when we look at enrollment numbers, what is the relationship between the Ministry of Health and the Ministry of Post-Secondary Education to ensure that there is an alignment?
Minister.
So there is strong alignment between the two ministries. I'll give an example. It's practical because on a practical example of success, I think the HCAP program has been the most successful human resources program the province has ever done. When we had to stand up in a pandemic and address major demand for healthcare assistance, there were different standards throughout the province. So the biweekly meetings between senior official of my ministry and the ministry that's led my colleague, the Minister for post-secondary, responsible for post-secondary education, helped arrange it. So we leveled that off so we could do the training throughout the province, which led to enormous success, more than 7,000 additional positions on both the infection control side and the 54 additional positions under HCAP, which included healthcare assistant positions in community for home support and in long-term care. It was a remarkable success, and it involved that key alignment of the Ministry of Post-Secondary Education, which drives a lot of the training, and the Ministry of Health. So that work is continuing, and we do that on an active basis every 2 weeks in order to ensure that those issues are addressed. There's a bursary that's been put in place for people making the transition. I know the member was referring to LPN to RN, I think, but from healthcare assistant to LPN, which is also a really critical area here because we really need LPNs, and we also need to provide opportunities to healthcare assistants to make that move to ladder in that level. And so a bursary was created, the Access to Practical Nursing program, which is a 12 or 12-month full-time bursary or a 24-month part-time bursary against a return of service agreement, and that's part of our Action 57 around bursary. So that comes out of the work that's been done and the clear alignment between healthcare and the ministry, which the member's responsible for as a critic. So that alignment is key. So as issues develop, including issues around perhaps under enrollment in particular programs, we can address those. Obviously, it's my colleague that will be, to the member will provide those clear and practical questions within her ministry. But but we're connected closely to that because some of that is about work experience, and that certainly was the case in the HCAP program. So that area demonstrates it's an area of success and shows how working together makes sense. It's not a health program or a post-secondary program. It's a combination. There's currently a wait list for all nursing programs, and so that tells us perhaps, and will tell us perhaps, that even though we've added 602 nursing spaces, that we're going to need to add more because there's a potential there. And we know, and I think what the member said about Athabasca is important, that BC is the desired place for people to come to work. And it's a real source of pride for our province that in all sectors we are net beneficiaries. So in terms of doctor training, 80% of those trained in BC stay in BC. That number for Alberta is 61%. Trained in Alberta stay in Alberta. 20% of those doctors trained in Alberta come to BC. We welcome them. That seems good to me. And 8% of those trained in BC go to Alberta. That's in the nature of things. People will live in different places in the country. So that's in the nature of things. But we're net beneficiaries of that change, and that's a system change. But that work, that alignment is a clear part of everything we do, and it reflects the work that that ministry does with my ministry and that minister does with me.
Member.
Much through you, Mr. Chair. I appreciate the member's comments about there's a waiting list for nurses across the province. Through you, Mr. Chair, does the minister have any comments of why on April 8th that the folks of Okanagan College faculty, staff, the community were stunned to learn that they're losing their nursing program?
Minister.
Well, there was an amalgamation, as the member knows, at UBC Okanagan. And so everyone got spaces there. All the staff have been offered employment and will be using the capacity at Okanagan College to advance allied health education. So that's not a loss of any spaces at all. And it's a practical decision that was made under the leadership of my colleague. I'm sure the member will have more questions for that. When her estimates come shortly, I can say I can't wait because I so enjoy the estimates process myself. I sometimes wish it would never end. And my colleagues do not agree. I don't think I'd win a vote on that in this room, but I'm a fan.
Member.
Thank you very much, Mr. Chair, and I will have lots of questions when we head into estimates. Just wanted to put that as a marker here because of the cross ministries. I'm going to go to a personal in the community. The minister has talked about Dunrovin in the past, and I always appreciate the ability to come and bring forward questions because I think ultimately we want solutions in the community. I do want to raise concerns that has been brought forward by multiple people in my community around the skyrocketing use of agency nurses, and that in the experience of Dunrovin, the only casual at Dunrovin has recently she's resigned because her income has dropped significantly. So what we've seen as a significant increase in agency nurses, and that has dramatically impacted nurses that are in my community that have worked and have built relationships with the clients for many, many years. And so we are worried in our community that we're actually going to be losing the nurses that exist in our community because of the agency nurses. We're very appreciative of the work that they're doing and coming in to support, especially during, the emergency. Now, as we move into what the next phase is, we do not want to lose any nurse in a community. As a rural community, that is even more difficult. And what we've also heard from our nurses is that that agency nurses are coming in and they don't have to pay their they get half. So our nurses get half the income. They still have to pay all of their fees and their dues, and yet we're bringing in agency nurses and they don't have all those costs. So through you, Mr. Chair, our community is very concerned and would like to raise that to the minister.
Minister.
Thank you for raising those issues. It's always important. It's one of the reasons I value this process, but also the work we do all the time. The member, as members will know, raises issues about Quesnel with me on a regular basis, not just Quesnel. I know her constituency is larger than that, but Quesnel is important. And what happens at Baker is important. What happens at Dunrovin is important. And so I appreciate that. Here's what I would say to the member. That agency nursing is 1.4% of nursing hours. There's a lot of nursing hours, so that's not a small number, 1.4%. I don't say it's small. It's higher in Northern Health where Dunrovin is. It's higher than that in Northern Health. It was closer to 8%, and that's a lot of agency nursing. One of the major purposes of the BCNU negotiations was to value our permanent workforce, our permanent full-time and part-time nursing workforce has to be given priority. It's important for the stability, especially in communities of the size of Quesnel, but smaller communities as well, which face sometimes even more pressure when they lose a single employee. That can be critical to them in providing care. The Dunrovin Lodge has benefited significantly from the HCAP program for the very reasons I described. That's nursing as healthcare assistance, but that's important in long-term care in particular. So I absolutely appreciate that. That's why we were so focused on that during the discussions with the BCNU, because it's a priority for nurses in places such as Quesnel, in places such as Prince George and Quesnel, and places in the Northern Health Authority. That was a particular priority of our discussions with the BCNU, was to address that very question, because we surely have to make the incentives right for long-time nurses who are, we can talk about new nurses, and they're so important, and we've got to recruit them, and we've got to make that work. But our long-time workers, ensuring they're retained and valued in the system, was a priority for the BCNU and a priority for us. And it was, of course, the whole province in mind, but it's exactly communities like Quesnel that we had in mind. We did also increase agency nurses. I had this discussion in more length, and I'm trying to shorten today my answers. I'm trying to shorten them a little bit with a member from Prince George Mount Robson, but just around the COVID-19 pandemic, we used more agency nurses because we had to keep all our nursing staff in place and add resources for things such as contact tracing and one over time. We're now at a different phase of that pandemic. It's not gone away, but a different phase of it. But this part of our focus of this agreement was exactly what the honourable member is raising, and she's hearing from nurses in community, which is responding to those needs, but also valuing our longtime nurses who deserve our support.
Member.
Thank you very much, Honourable Chair. My last question is when we talk about recent graduates of specifically our nursing program and making sure that we invest in our students and we want to ensure that they have success. And we've certainly, over the last few years, another indicator that I think we need to measure is, are we retaining our students, they graduate, are we retaining them? And what does that number look like? And one of the things that has been raised to me by both students and from trainers is that we've seen a shift, specifically in Northern Health, that there has been a cut in the education budget, and it has moved from we used to have educators on the floor in hospitals, and that was a really important support for both students that are recently graduated but as part of the training one, and it's moved to a regional training program which is not embedded in the hospital, and that has been a significant concern raised by both students and graduates.
Minister.
And this was a key item in the collective agreement. And again, we've been talking about this. It's not yet been ratified, although we'll hear tomorrow, for that. But that issue of clinical education on the floor was a key aspect and is addressed in that agreement. The member is quite right that one of the challenges that happens in an unbelievably busy workplace like Baker, like Royal Inland, like University Hospital of Northern BC, like long-term care, is that support for new nurses as they come in, and it's critical that be in place, and that's was a priority for us in those discussions and for the BCNU, was how we ensure that people come in, we recruit them, we do all this effort, internationally educated, coming through our training systems. We want to make sure that they're supported when they get there. And the challenge for existing nurses who have that on the floor, have new nurses who are not as experienced. And this is not just the case the way in health, but in education and other areas, like new teachers and the supports that we're providing for them in a community such as Surrey, where we have a lot of new teachers, and making sure we're supporting and retaining and supporting them as they go through their early years in that profession. But in healthcare, it's been a significant part. The issue the member raises was one that's raised by nurses in her community and communities across BC, which is how we retain and support. And that issue of clinical education was specifically dealt with in our negotiation. We'll see how it goes tomorrow.